I'm delighted to tell you a little bit about some of the work we're doing to connect data to create a more fair data ecosystem, enhancing software. And I'd like to focus my talk on some of the work we're doing in our digital health platforms. But of course, there's a lot of work that's happening, and I can only just show you a small bit of a slice of the larger pieces. There's some compelling use cases that really do keep me up at night. I'm going to just show you two of them, and I'm wondering if these are also keeping you up at night, but these are things that I'm actively working on. And for many of us in the room and remotely, you're going to be writing a grant, an R01, or maybe a center grant, and you'll need to submit a data management and sharing plan in 2023. January 25th of 2023, our data management and sharing policy will become more than just a policy. We need to put those fair practices into real principles. And you'll likely ask me and ask our NIH colleagues, how will you do that? How will you find the appropriate data repositories? And how can we think ahead about making data a future research material, not just the outcome of an experiment or a model? And so how can we really make data live beyond its current use? And that's the hope and the goal of the data management sharing policy. Another compelling use case that probably drives most of us here today, and this is really from a lovely article in Biosensors that came out, I think, in January of this year, looking at the wearable capabilities for the detection of SARS-CoV-2. Everything from smart rings to measuring blood pressure, wearables for metabolites and skin temperature, microneedle patches for looking at, for example, glucose levels or inflammation markers, smart patches for monitoring heart echocardiograms. Interestingly, teeth sensors for drugs and antibodies, smart lenses for looking at intraocular pressure, face masks, of course, we're all wearing face masks and may continue to do so for breathing patterns or airborne pathogens, smart textiles for skin temperature, and again, perhaps even metabolites. Interestingly, external tattoos for stress biomarkers or cholesterol, or even smartwatches, which many of us are now using today in research. And this is all compelling for the detection of COVID, but I want to give you a different use case. I'm working on long COVID with a number of colleagues through our Recover program. The collection of longitudinal data near to real time using many, if not all, of these types of different sensors and wearables is really important to understanding the evolution of COVID and long COVID. Long COVID is not a disease that affects one body or organ. It's almost uniform across the organ systems, from brain to heart to liver. There's very hard to describe the phenotypes of long COVID. Moreover, understanding how to treat long COVID is still something that we're grappling with. The linkage of these types of sensors and mobile and digital data with electronic healthcare data, medical records, and other types of data like genomics, metabolomics, skin temperature would really help us understand and treat long COVID. But most importantly, long COVID is not, although it affects all of us, it doesn't affect us all in the same way. And engaging diverse populations who are often more affected by the effects of COVID is incredibly important. Making sure that there's ready access to and adoption of these types of technologies in those communities is of utmost importance for addressing the pandemic today and its long-term after effects and potentially even future pandemics. So this is a use case that I'm actively working on, and I'll show you a little bit about what we're doing here. But first, I just want to turn our discussions and our thoughts over to making and enabling data to be fair, findable, accessible, interoperable, reusable, creating repositories that adhere to the trust principles, and instantiating that data management sharing policy into a real plan. I love this slide. It's from my friend Ingrid Dillow. Talks about fair data and improving data discoverability in a really nice and graphical way. Everything from making sure the data has persisting unique identifiers, to making sure that the metadata is computable and available, to understanding the intricacies of oncologies and vocabularies and linked metadata, to finally the thought of reusability in terms of provenance of data, data community standards, and the multiple metadata. So this is just one way to think about the crosscut of making data fair. Making data fair and AI ready, it's not something that can be done necessarily just in the future. We can start today. So one of the things that we've been thinking about is how do you actually take data that's instantiated today from experiments and create enhanced AI, data for AI and FAIR. It's not simply formulaic. It requires engagement from researchers and feedback and use cases to drive forward this action. There are aspects of data, such as the representation of information, the presence of noise, and I've heard some really wonderful discussions today about noisy data, the uncertainty of the labeling, the metadata, the limited amount of data, its plasticity, and just these are just some of the challenges in preparing existing data to become AI ready and fair. And there are other challenges such as data documentation, provenance, attention to bias, so important when thinking about AI and AI ready algorithms data that we do need to consider. So I want to show you what we've done in just taking existing data and creating data that's more fairable and more AI ready through a support for collaborations to bring together expertise in biomedicine and data management, artificial intelligence, and information sciences to take existing data and then create AI ready data. We made 36 awards this past year, and you can see some of the statistics here, as well as all of the ICs listed at the bottom who participate with us in this initiative. Some of the common areas of focus, not surprising, included Alzheimer's disease, cardiovascular disease, and aging. And some of the data types that people were interested to create AI and fair ready data were imaging, that's a big win, of course, electronic healthcare related data, omics data, and interestingly, speech. I think we're going to continue this program as we learn how to take existing data and from that create AI and fair ready data. I want to show you just a few of the awards that we made because I thought they would be interesting. And this is just a snapshot in the sector of imaging. There certainly is really interesting genomics applications and other types of applications. From the University of South Carolina, Dr. Desai is studying how concepts that are represented in processes in the brain can be improved by using semantic language techniques to really create machine readable metadata. Dr. Gilmore from the University of North Carolina, Chapel Hill, is studying images in order to identify really early children who might be at risk for schizophrenia. And what he's doing, this is just totally fascinating, is he's using the out of the distribution detection machine learning algorithmic models to impugn new data or missing data from existing data at different time points. And finally, Carl Kasselman from the University of Southern California is streamlining curation of existing metadata to enhance the images that are in the FaceBase data hub. So FaceBase is a consortium of distributed network of researchers who are interested in investigating craniofacial development and dysmorphia. And the hub stores these images and representations and serves them up to the biomedical community. And so again, what he's doing, he's looking at streamlining approaches for curation of images in the FaceBase infrastructure. These are just a few of the examples, but I thought they might be interesting to give you some sense of how people are taking existing data and creating more fair ready and AI data from this. Creating fair and AI ready data is just the first step in the conversation of data sharing. And so I want to show you that there's really going to be no one size fits all. It's going to take a village to create data sharing capabilities. But as a first stance, NIH strongly encourages researchers to utilize the open access data sharing repositories that are part of your community. And there's a lovely list from this website at NIH and the National Library of Medicine. We call it BMIC, Biomedical Informatics Consortium, that lists both the NIH supported data sharing repositories as well as the generalist repositories. And you can see there are different options. For example, you can actually store your data as part of supplemental materials in your publications archived on PubMed Central. These are available, the data is available on the AWS Open Data Platform. I think that the size may have gone beyond 2 gigabytes, but at this time, not too long ago, it was at 2 gigabytes. Of course, there's lots of different options. There's also the community-driven nonprofit generalist repositories, as well as a program I'll talk a little bit about, the Strides Cloud partnerships with AWS, Google, and Microsoft Azure. Again, though, I do want to stress that we encourage you to use the open access data sharing repositories that are supported by your community as a first approach. We understand that there are many different types of data repositories, and they come in different sizes, different complexities, and quite frankly, different levels of maturity. And each of these do bring a lot of value to the research areas that they are intended to support. Being able to address the readiness to adhere to desirable characteristics as outlined by the Office of Science and Technology, OSTP, as well as aligned to the FAIR principles, and I'll talk a little bit about the trust principles. It's a spectrum, and developing metrics for usability, utility, and impact within a repository is also an evolving function. And so what we intend to do is to support repositories to really enhance FAIR abilities to share data and trust as a repository and align to the desired characteristics. So this past year, working with many of the institutes and centers at NIH, we have supported existing repositories to align with the FAIR principles, to align with the trust principles of transparency, reproducibility, focused on the users and use cases, sustainability and technology, and to evaluate and utilize user statistics, utility, and impact. We have 17 awards, and you see a little bit of the statistics. We're also creating a larger ecosystem of data repositories where we collaborate on common and shared goals, such as potentially linked and searchable and core metadata, persistent identifiers for data, authentication authorization when the data is in controlled access repositories. And then, of course, repositories have unique features that are individually supported, such as data dashboards, visualization, linking to publications and analytics. So I hope that I'll be able to tell you a little bit more about how we're creating a data repository ecosystem, knowledge-based ecosystem, as this evolves. This is all based on this wonderful workshop that we held a year and a half ago with co-chairs Marianne Matone and Shelley Stahl. And the report has just guided us so much in creating this data ecosystem. So we've talked about FAIR data, creating and instantiating repositories that align with characteristics that are desirable, as well as enhancing FAIR data. So now I want to talk about creating more than just data repositories, but really platform interoperability. This starts at the beginning with a discussion of enhancing data storage and compute on the cloud. Because when we have data in the cloud, it is a lot easier to create a federated system. It does not necessarily require repositories, platforms to be on the cloud, but we're finding that there's a lot of capabilities that we can take advantage of by utilizing our partnerships with AWS, with Google, and with Microsoft. And the STRIDES program stands for Science, Technology, Research, Infrastructure for Discovery, Experimentation, and Sustainability. It's quite a lot to say, but what it really is it's providing discounted data storage and compute capabilities on all of these three cloud providers. Many offer training and educational resources for researchers from undergrads to experienced PIs. And then in some cases, we're taking advantage of the unique capabilities of our industry partners with technologies such as large-scale analysis, artificial intelligence, machine learning, and search. So this is a snapshot of where we are in our program with STRIDES. And what I want to point out to you is that we've done a huge lift and shift. We've lifted about 115, it's probably more like 120 now, petabytes of data into our two cloud service providers. We're now engaging on our third cloud service provider, Azure. We've instantiated over 100 million compute hours. Many programs are engaging with our STRIDES program, our STRIDES partnerships. So that's if you're interested, I think reviewing the website and certainly contacting us on how to engage in STRIDES is a desirable outcome of our meeting. More than 48 petabytes of sequence data has been moved into Google and AWS. And this has been a really interesting challenge in managing large-scale data platforms in the cloud. Just imagine how you're going to search for sequences of, let's say, the evolution of SARS-CoV-2 virus over 48 petabytes of data. It's kind of a hard challenge. We've been able to do some things that we would never have been able to do had we not moved this data to the cloud. For example, we have looked at the evolution of SARS-CoV-2 virus by doing a petabyte scale sequence alignment in AWS, and this is done in partnership with AWS to help move some of those analytic platforms into sort of high profile, high performance analytics. And because we were able to shift all of this data to the cloud and then create these alignment algorithms by taking advantage of some robust HPC capabilities, we can now do the analysis in 3 to 4 days instead of the 12 or plus months that it would have taken to do all of these sequence alignments of the virus. So this led to an interesting collaboration between DOE and NIH on actually how do you instantiate petabyte scale sequence search over 48 petabytes of data. Both agencies have the similar situation and similar problem. So we're focusing on metagenomics. For us, of course, it's the metagenomics of health-related viruses. And for DOE, it's the metagenomic samples in the environment. Developing new tools to query raw sequence data and benchmarking these tools on the National Microbiome Data Collaborative is the goal of this coming year. And we've already had a number of codathons or hackathons to start developing these tools. So when we're moving all of these platforms, and you'll see them listed here in this little cloud diagram, into the cloud, we have a unique opportunity, and that is to create a much more closely connected and federated, in some sense of the word, capability across these cloud platforms. And you see them listed: cloud platforms from Biodata Catalyst and the funding from the National Heart, Lung, and Blood Institute that really takes advantage of not just the top med data, but other data coming from different types of clinical trials. The Gabrielle Miller Kids First data resource. NCBI, the National Library of Medicine, and dbGaP, the Cancer Research Data Commons, which holds genomics, proteomics, imaging, and other data related to cancer studies. And the Anvil, the GTEx and genomics platform for the analysis of genomics data. All of these platforms are unique and they have vibrant communities who work on them, but oftentimes a particular use case is that there's data either from participants who have contributed data across most of these platforms, or there's capabilities that can be leveraged across these platforms. And so what we aim to do in this coming year, and this has been a pilot for about 1.5 years, is to establish and implement not just guidelines and technical standards, but real end user analytics across our participating platforms. What does that look like in terms of an impact or an outcome? Here's a particular use case that we've been working on. It's the genetic factors related to congenital heart defects. In this case, the study design would like to use healthy cohorts from 2 NHLBI studies in the Biodata Catalyst platform, and then pull data from the NHGRI Anvil and the Kids First platform to actually look at genetic variants. The investigator would like to pull all these analysis and do the platform on one particular platform, Anvil, and this would be powered in by the Terra analysis platform. So creating interoperability and actually instantiating that use case is challenging. This is a slide that's shared from my friend Melissa Hendel. There's many different barriers. There's the restrictive licenses that data can have and how it can be combined. There's the way that you actually access and control and match the regulatory permissions of who can use that data and how. And even if you can overcome those two barriers, oftentimes platforms really can't talk to one another easily and make that analysis and move data across platforms. And then even if you could accomplish these 3 things, data are often encoded in different models, different ontologies, and so it does make it very difficult to do an integrated analysis. Yet these are the problems that we would like to solve for greater science. So the first thing that we did is we improved the way that researchers can access data at NIH by streamlining our authentication authorization processes. We leverage programs that are supported by other efforts, including the standards from GA4GH, as well as work that's being funded both by us and by NSF. We align with our administration's cybersecurity goals. Cybersecurity Zero Trust is coming to a platform near you in the very near future. And the idea, of course, is to enhance greater streamlined data access across most of our platforms. And enhancing data access is a goal of my office. It is a very complicated thing for researchers to easily get access to different types of controlled access data. And so we are working on it. This is just a quick overview of how we are instantiating single sign-on. Basically, it tells you that the before state was very complicated. People would have to sign on with multiple credentialing across multiple platforms. And we simplified it. You can log in with your ERA Commons. You can log in with your university credentials. I think coming soon will be your ability to log in with your ORCID IDs. We may eventually get to your Google credential systems, but that's, we'll see. Many of the data repositories are connecting in our single sign-on login capabilities, and you see them all listed here, including a few that I'm going to mention in the future. So what does it look like to create interoperability? It really creates the ability to search across multiple platforms, authenticate people so that they can sign on and easily get access to all the data that they are credentialed for, and then pull the data into the workspaces that they're interested in. And for the interest of time, I'll cut to the where we are. This is our latest use case and success story. Melissa Wilson from the University of Arizona University is examining sex as a biological variable. She'd really like to assess the calling of X and Y chromosomes. She'd like to pull all this data from all of the platforms that she has that data accessible to, including the ones that I've mentioned. And she does that on demand without copying the data. So now she can pull over 11 petabytes of data across 4 systems into one platform and do the analysis. And in talking with her at the beginning of this project, she's been a use case since we started this program. It was taking her at least 2 years to get access to all of this data. Now she can do it in less than a week. So from my point of view, it's an improvement. And no data was duplicated, so that's also an improvement. There are other efforts at NIH that are creating data ecosystems. I'm just going to mention because it might be the case that some of you are involved in or aware of the Common Fund. They are creating data capabilities across all the Common Fund efforts to create a data ecosystem. And you'll see here a number of the Common Fund programs that are working together. Particularly, you might be involved in HubMap or in Kids First or GTEx. And so you'll be able to link data across those platforms. We're also working with the Medical Imaging and Data Resource Center, MIDRIC, which is creating interoperability across many different platforms. MIDRIC is the Medical Imaging and Data Resource Center, pulling data, mostly radiological data, in collaboration with the societies, radiological societies. And we're creating now greater interaction between MIDRIC and many of the platforms that I've talked about. I won't go into this too much, but just to say that we are creating a shared cybersecurity platform for the sharing of data across multiple systems. But what I really want to get to is how we are doing this to address COVID, because I want to talk about the digital health work that we're doing. Just as a reminder, in case you are not aware, RADx is Rapid Acceleration of Diagnostics Technologies, and we have a number of programs, the RADx Tech, the highly competitive 3-phase challenge, it's like the Shark Tank, to really get to high throughput at-home point-of-care testing for COVID. And the idea is to get millions of tests in the hands of all of our citizens as quickly as possible. RADx ATP scales up these technologies into an ultra-high throughput machines and facilities. RADx Radical is the development of novel and non-traditional approaches for testing, and RADx Underserved is really getting testing and technologies into the hands of the underserved populations. What I want to tell you about is our Digital Health Solutions program. It's a broad range of innovative digital health solutions to help address the COVID-19 pandemic. And you can see them listed here. There's a digital health systems data hub, and encircling that are all of the funded awardees for the digital health solutions. You can see the phase, the timeline from 2020. And what are they doing? They are creating a platform for curated models and data to enable performers. So this is a partnership with to store and share their digital health data, their models, and their tools. I'm going to show it to you in a different figure, a little bit blown up. But what you'll see is that all of the mobile health platform data, wearable sensor data is going into the digital hub, where they are storing the original data and the curated data, including the metadata, the study data, and the process data. They're doing standardizations and imputation of data, data janitoring, so important when you're doing harmonization and curation, and then, of course, the harmonization and the validation. And then they're doing some really interesting work on AI and training and model validation. So I think this is something that you want to pay attention to. The person at NIH who is running this program with me is Andrew Weitz, and I plug in here at the little bottom corner where it says RADx Data Center. That is my work, but I want to point out the work that Andrew and his team is doing in partnership with BARDA and the Department of Defense, as well as other colleagues. And you can see the types of data that are coming in from our digital health platform program for COVID-19 include survey data, demographics, medical histories, self-reporting systems, behavioral and mental health data. I heard some really fantastic talks earlier about mental health and sensor data, as well as physiological data, such as data from Garmin and novel sensors and Fitbit, and then other, of course, other lab testing and RNA-seq data. Andrew shared with me a few early lessons learned from trying to collect, harmonize, and make available wearable technology data. And what he mentioned to me was that it's a big opportunity. It's an open field, but it really needs to be defined in terms of the context of the use, in terms of what can we learn from the data and how can we use it. He mentioned that working with underserved and underrepresented populations does require establishing trust and leveraging relationships within the study populations is something we're finding to be true across the board. Interestingly, men who are more vulnerable to COVID-19 are not participating in the studies, digital health studies, as much as women are. And then, of course, public health and public attitudes have changed significantly and impact their ability to use digital health certificates and digital health passport technology. So just a few things that we are paying attention to from this study. I want to talk a little bit about what we're doing to improve software, because data, as I've heard it said, it's just a wonderful thought. If data is the oil, new oil, then software is the refinery. And so making and enhancing data and providing data as platforms, but then creating knowledge from data requires software. And so here are just a few ideas of what we're doing to help improve the software connections with data. And I'm going to talk very specifically about our partnership with the National Science Foundation and Smart and Connected Health. Our goal in our partnership with NSF is to accelerate the innovations in digital health communities by bringing together computer scientists, information scientists, and engineers with biomedical researchers to really impact and transform medicine and health. So this is a program that has been funded by NIH since, I believe, 2015 or 14. It's about a $20 million a year program, and you'll see from the pie chart the institutes that are participating and the number of projects that they are funding. These are NSF or NIH funded projects. NSF has an additional cohort of funded projects. So altogether, I think the program is probably much more like a $35 million a year program. Not surprising, the National Institute of Biomedical Engineering and Imaging has the largest sector of applications that we are funding, but others follow suit as well, including the National Cancer Institute, the National Institute on Aging, and the National Library of Medicine and Mental Health. And by scientific area, while artificial intelligence is the largest proponent of applications, it's also embedded in many of these other applications as well, including sensors, wearables, and images. In terms of diseases, certainly nervous system diseases and cancer are important factors that researchers are interested in when applying to this program, but so is mental health disorders, brain disease, cardiovascular disease, even skin disease. So there's a lot of opportunity. Let me show you a few of some of the things that, the image is funny, that we're funding, so that you can get a sense of just what people are doing in this program. And this is just one application, for example, racial bias in pulse oximetry measurements, and leveraging clinical time series to learn about the optimal treatment for acute dyspnea from an electronic healthcare record data analysis. And the conclusion from this work was that Black patients had nearly 3 times the frequency of occult hypoxemia that was not detected by pulse oximetry as white patients did. Another particular application from this program, and most of these programs are developing wearables and sensors in one way or another. This is a soft wearable microfluidics device for the capture and storage of calorimetric sensors. And I think here the goal is to reduce the amount of invasive blood draws that would be necessary to measure caloric levels. So this wearable microfluidics device aims to provide quantitative values for sweat, as well as concentration of chlorine and lactic acid, lactate. In this particular example, this is a flexible near-field wireless optical electric subdermal sensor. And here the goal is to provide a system to allow for the analysis of light, delivery of light into optical tissues. And I think this is my last example for this one. In this case, this is a wireless sensor for the continuous multimodal measurement of the skin interface between your lower limb and a prosthetic. And as you probably know, because you're experts, that the near where the prosthetic and the limb meet, there's a lot of stress and changing in volume and shape of the limb. And so this sensor really helps alleviate some of the potential pain that a patient may feel. And so these are just a few of the many examples that we're supporting through our partnership with NSF. And I hope that if you're interested, you will consider applying. I think the applications are twice a year, in the fall and in the winter time. Before I close, I want to just tell you a little bit about what we're doing to build a diverse data science workforce, because all of this wonderful work in creating fair data, enhancing data ecosystems, providing platform interoperability, and building software requires that we build with it a workforce. So we have a number of programs. I hope that you'll consider giving to NIH in terms of encouraging your undergraduate students to think about spending 10 weeks at NIH, either virtually or in person. We host a number of students each year. They are from computer science undergraduate students, information science, economics. We had a history major, a music major. They work on really interesting problems within NIH. A lot of them work on some form of artificial intelligence in terms of developing classifiers and dashboards, ways to think about analyzing data availability statements in your applications and in your publications. They might work on improving data management capabilities at NIH. In one case, the work that has been done over this past year in the analysis of gender, racial, and ethnic disparities and predicting priority scores resulted in a publication. So they do publish when they come here, and they're just a wonderful group of kids. The second program I want to let you know about is the Graduate Data Summer Program. It's a 14-week program. It's a 10-week summer program where the students who are master's students come, again, either in person or virtually, to NIH and work in our intramural program, often on really hard data science programs, and they're placed in intramural research labs. I also want to let you know that we have, similar to NSF, we have a program to bring experienced scholars to work at NIH for 1 or 2 years as a sabbatical. You could come from academia. We have scholars who come from industry, from nonprofits, and even from other federal agencies. And they work on really hard problems. These are just some of the problems that our scholars are currently working on, including catalyzing neuroscience research, unraveling Alzheimer's genomics, supporting knowledge extraction through developing really interesting knowledge graph and harmonization capabilities. We have a program where our data scholars working on adopting machine applications with the program I talked about, MIDRIC. So how do you actually accelerate machine intelligence for medical images? Another scholar is working on harnessing data science for Africa. We have a scholar who's working on expanding brain circuitry and the theories of brain circuitry. Oh, sorry about that. And finally, the program that I talked about in terms of petabyte scale search is being run also by a data scholar. So if you're interested, the call for data scholars comes out in the April timeframe, and the scholars start in the fall of the following year. So we're now onboarding our new scholars this year. And finally, we host a monthly series, the second Friday of each month at noon, to highlight data science activities at the NIH institutes and centers. This is a way to learn about programs in data science that are supported by all of our institutes and centers. And each month we feature a new institute or a different institute. And the speakers talk about the way that they're using and reusing data to answer their own questions. And our hope is to show and illustrate the value of data sharing. So our next seminar is November 19th, not too far away. Alexander Ropoliski from the Pittsburgh Supercomputing Center will talk about the Brain Imaging Library as a resource for sharing microscope data. And so this is hosted by the National Institutes of Mental Health. It takes a village to do all of the work that I very quickly described. And so our office is small. We sit in the office of the director, and our goal is to catalyze data science from across all of the institutes and centers. And to do so, we work with almost 200 people. We work in different types of working groups, and we together enable things such as the STRIDES program, creating interoperable platforms, implementing fair data sharing and enhancing data repositories, creating software and a software ecosystem, as well as our partnership with NSF on smart connected health. We action, and I didn't talk about all of the work we're doing in artificial intelligence, including our new program, Aim Ahead, to address health disparities and health inequalities. We work to build a data science workforce, and we're now working with our institutes and centers on enhancing data science in their granted centers and programs. And finally, we work on policy with our colleagues on policy and implementing the data management and sharing policy. And with that, our goal is to create something more than just the sum of its parts, but to create a data ecosystem that's integrated and fair and equitable.